this video is a continuation of my previous video in which we had discussed the physiology of skeletal muscle contraction, the classification of skeletal muscle relaxants, and depolarizing neuromuscular blocking agents. In this video lecture, we will be focusing our talk on spasmolytics. Spasmolytics, as the name itself is suggestive, it reduces the increased muscle tone to normal. So the hypertonic muscle is returned to the normal state. Spasmolytics can be classified as centrally acting muscle relaxants and directly acting muscle relaxants. The centrally acting muscle relaxants produce action in the brain and spinal cord, whereas the directly acting muscle relaxants produce action beyond the neuromuscular junction and the NM receptors that are present in the motor end plate and produce action directly within the muscle and cause relaxation. The drugs that are included in the category of centrally acting muscle relaxants are the mefenicin group, which includes drugs such as chlorzoxazone, carisoprodol, methocarbamol, and so on. The second group includes the benzodiazepine group, which includes drugs such as diazepam and clonazepam. Thirdly, baclofen, it is a GABA-B agonist and reduces spasticity. Tizanidine is an alpha-2 agonist and helps to reduce painful muscle spasms. Next, there are anticonvulsants such as gabapentin and pregabalin, which act as anti-spasticity agents. And lastly, we will be talking about riluzole, which is a glutamatergic drug. The directly acting muscle relaxants includes dantrolene, which is the drug of choice for neuroleptic malignant syndrome. So let's now discuss each of these drugs in details. The mefenicin group includes drugs such as chlorzoxazone, carisoprodol, methocarbamol, and so on. These drugs produce action in the spinal cord. As we can see in the figure, they block the interneurons that play a role in the transmission of impulses across the synapses. So by blocking the interneurons, they inhibit the transmission of impulses across the synapses and affect the muscle contraction and cause relaxation of the skeletal muscles and reduce spasticity. They preferentially inhibit polysynaptic reflexes. The drugs include chlorzoxazone, carisoprodol, and methocarbamol. Chlorzoxazone has a longer duration of action of 8 to 12 hours, but it has a slow onset of action. Carisoprodol has a medium duration of action. In addition, it has analgesic and antipyretic properties which are beneficial, but it also has anti-muscarinic side effects, so blurring vision is a side effect. Carisoprodol produces mecprobamate, which on long-term use can produce tolerance and dependence. Methocarbamol has high first-pass metabolism, therefore preferentially it is given by parenteral route. The next group of drug is benzodiazepine group, which includes diazepam and clonazepam. So these drugs facilitate the binding of GABA to the GABA receptors that are present throughout the central nervous system, that is brain and spinal cord. GABA is an inhibitory neurotransmitter, and by enhancing the GABAergic transmission in the brain, they help in reducing spasticity associated with several neurological disorders such as multiple sclerosis. They also produce action in the spinal cord and inhibit both monosynaptic and polysynaptic reflexes. Thirdly, benzodiazepines, by enhancing the GABA action on GABA-A receptors, they can facilitate the presynaptic inhibition of release of excitatory neurotransmitters such as glutamate, neuropeptides, and substance P into the synaptic cleft, and this helps to reduce the excitability in the muscle and reduce muscle spasm. Thus, benzodiazepine, by acting as an agonist at GABA-A receptor, inhibit the release of excitatory neurotransmitters that are responsible for excitation in the muscle. Benzodiazepines can also reduce muscle spasm that is associated with local muscle trauma. Thus, benzodiazepine can act as both centrally and peripherally acting muscle relaxants. In terms of side effects, sedation is a common side effect of benzodiazepine, and it also produces tolerance and dependence on long-term use. Benzodiazepines are useful in reducing spasticity associated with multiple sclerosis, spinal injuries, and they help to reduce muscle spasm associated with tetanus and rheumatic disorders. The next drug is baclofen. The site of action of baclofen is spinal cord. As we can see in the figure, baclofen stimulates the GABA B receptor. GABA B receptor is a G protein coupled receptors that are present in the postsynaptic neuron. So baclofen, by acting as an agonist at GABA B receptor, causes hyperpolarization, relaxation and reduces spasticity in the muscles. Secondly, they can also stimulate the GABA B receptors that are present in the presynaptic neurons, which have an inhibitory role. They inhibit the release of excitatory neurotransmitters such as glutamate and substance P into the synaptic cleft and prevent post-receptor activation. So by reducing the release of excitatory neurotransmitters such as glutamate, neuropeptides and substance P, thus, baclofen, by stimulating the GABA B receptors that are present in the presynaptic neuron, reduces the release of substance P in the spinal cord, which is a neurotransmitter that is responsible for pain. Therefore, they are useful in reducing painful spasticity that is associated with spinal injuries or multiple sclerosis. However, these drugs are not useful drugs in the treatment of cerebral palsy. They are also useful for the treatment of trigeminal neuralgia, which is associated with pain, and tardive dyskinesia that causes painful muscle spasms. In terms of side effects, it can cause dryness of mouth which subsides on long-term use and also produce transient sedation. The next drug is tizanidine, which is an alpha-2 receptor agonist. By stimulating the alpha-2 receptors that are present in the presynaptic neuron, it inhibits the release of excitatory neurotransmitters such as glutamate, neuropeptides into the synaptic cleft and prevent postsynaptic receptor activation. Thus, tizanidine, by acting as an agonist at alpha-2 receptors of the presynaptic neuron, regulate glutamate release and glutamate-mediated postsynaptic receptor activation. They are useful in reducing spasticity associated with neurological disorders and reduce painful muscle spasms associated with spinal injuries. The next group of drugs is anticonvulsants, and this includes drugs such as gabapentin and pregabalin. They act as anticonvulsant agents, but they also help in reducing spasticity. In terms of mechanism of action of these drugs, they inhibit the alpha-2 delta subunit of the calcium channels, thus inhibiting the entry of calcium. Calcium is known to cause release of the excitatory neurotransmitters into the synaptic cleft and causing excitation. So by inhibiting the calcium entry, it inhibits the release of excitatory neurotransmitters into the synaptic cleft and thus reduce the excitability in the muscle and help in reducing the muscle spasm. These drugs are useful in the treatment of neuropathic pain, in herpetic neuralgia, and in reducing spasticity associated with multiple sclerosis. The next drug is riluzole. Riluzole is indicated in the treatment of amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis is a disease of the nervous system in which the nerve cells weaken, causing the muscle to go out of control. In terms of mechanism of action, riluzole inhibits the voltage-gated sodium channels, thus inhibiting the release of excitatory neurotransmitters and decreasing the excitability in the muscles. Thus, riluzole reduces the spasticity associated with amyotrophic lateral sclerosis and reduces the progression of the disease. So this was all about the centrally acting muscle relaxants. Coming to directly acting muscle relaxants. Dantrolene is a drug that belongs to this category and interacts with the contractile mechanisms that are present within the muscle, producing relaxation and reducing spasm and muscle rigidity. Dantrolene is the drug of choice for the treatment of neuroleptic malignant syndrome, in which there is a mutation of ryanodine receptor or the calcium release channel, which causes uncontrolled release of calcium, resulting in persistent muscle contraction, muscle rigidity, and also there is massive metabolic reaction resulting in increased muscular heat. So this results in hyperthermia, muscle rigidity, tachypnea, tachycardia, and is a life-threatening condition. Dantrolene is a drug that blocks the ryanodine receptor, thus controlling the release of calcium, reducing the release of calcium, and helps to control the manifestation and is useful in the treatment of neuroleptic malignant syndrome. It is also useful in treating clinical spasticity associated with upper motor neuron disorders.
This brings us to the end of the topic. These are my references. Thanks for watching. Please like, subscribe and share.